Self-collection is brand new at home in the US market. Initial awareness among clinicians and patients is fairly low. We do know from past surveys that around 80% of women want a more comfortable, less invasive HPV testing option. We also know that adoption takes time, but international precedence shows immense potential in countries like Australia, New Zealand, Netherlands, and Sweden. Self-collection now accounts for as much as 55 to 90% of cervical cancer screening. What we're doing is continuing to add partners, particularly large regional and national labs that will permit us to have a broader distribution of at-home self-collection kits, expanding access to screening to patients anywhere they are and clinicians anywhere that they are. And we want to continue to raise awareness under clinicians and patients for self-collection at-home options. And I appreciate this opportunity to speak with you about it because that's how we can raise awareness. As clinicians of any type in the US, we're expected to check in with women to determine if they're eligible to be screened based on the last time they were screened. This could be very easy if they're an established patient and we have a good EMR. We can just know that. For relatively new patients, we should inquire at a visit to see the last time they've been screened in case this is an opportunity. The screening can be clinician-based. It can be in-clinic self-collection or it can be at-home self-collection. So this should be happening at every visit, basically, to make sure that cancer screening opportunities aren't missed. Ideally, this might fit with primary care drop-in patients who have unrelated healthcare visits and the clinician discovers that they haven't been screened within the appropriate interval. And if they're not able to do a speculum exam, this is a great opportunity for self-collection for the patient who might otherwise leave the clinic not being screened and not having another opportunity. For the ACOG audience of OBGYNs, they're likely screening their patients now. So self-collection at home would be for those patients who decline the speculum exam and clinician collection. Examples include trauma survivors, patients with past medical or sexual trauma who avoid speculum exams. One of my areas of expertise is vulvodynia, which is another reason a patient simply can't undergo the exam. So this is an opportunity for them. There are patients with physical and mental disabilities who can't collaborate with an examination or find it very difficult, and so this might be an alternative. The decision ultimately remains a shared decision between the individual patient and clinician based on patient preference.